If you're struggling with gestational diabetes diagnosis like I am, here's a few tips to help you. Hi, I'm Dr. Nina. I turned 40 this year. I also became pregnant with my third child, and I've recently been hit with a gestational diabetes diagnosis, which for someone who's really interested in longevity medicine and optimizing their health was, let me tell you, a bit of a shock, but here's how I'm embracing it. The first thing that I tried to do was to take a positive spin on the pregnancy, because it's really easy to say, okay, I've got gestational diabetes, this means I'm at higher risk of getting diabetes in the future, and my baby's going to be affected, it's going to be huge, and all of these complications, but the chances are that none of that stuff is going to happen, or it might have happened even if I didn't get diabetes. The best way of looking at it from my perspective is that now I have the chance to really optimize my health. It's really spurred me on in terms of tackling my healthy eating, because to be honest, my Dr. Pepper habit was getting a bit out of hand. So accepting the diagnosis and trying to look at it in a positive light rather than negatively has really helped me, just accepting it. I think this is also something that comes with being 40. You just don't care so much anymore. Tip number 2, exercise snack. Everyone says take a 10-minute walk after you have a meal, and this will help your blood glucose levels. And sure, exercise is a great way to optimize your blood sugar, but I work in a busy clinic and I don't have time to take 10-minute walks after I eat. Most of the time I'm eating something rushed at my desk, and then I'm getting straight back into my admin tasks, seeing patients, calling people, so I just don't have time. But there was a recent study that showed that one thing you can do is squats. You can literally do them anywhere. I'm not going to show you my squatting because, to be honest, I don't think the technique is very good. But yeah, I try to get up and I move around. I have an Apple Watch, and this does remind me to get up and move around every hour or so, and I find it very helpful. Tip number 3 is hydration. Most of the time when people think that they're hungry, they're actually just thirsty. So whenever I feel like I need to reach for a sugary snack or something to eat, I try to have a big glug of water and make sure that I'm hydrated. Tip number 4 is sleep. If you're not sleeping properly, which is probably the case if you're pregnant, especially during the later stages of pregnancy, then don't be too alarmed if your blood sugars are affected, because sleep is one of the things that will affect your blood sugars. Obviously, if you can optimize your sleep with a cool room, with a routine, with a sleep schedule, then that's the best. I have 2 little children, so I'm not going to lie, my sleep is pretty poor. So if you've just got a gestational diabetes diagnosis, if you had one in the past, if you're going for a test, or you're just worried about all of this stuff, I know it can be confusing. Even as a medical doctor, it's still confusing for me, and I find it quite stressful. So I empathize. Don't worry, you've got this. Yes, it's a shock. Yes, it's difficult, and it can sometimes be confusing and stressful. If you have any questions, pop them down below. I will answer them in another video. If you like this video, please hit subscribe. It will help to motivate me to make more videos for you.